My name is George Mahuku. I'm with the International Institute of Tropical Agriculture. I serve as the country representative for IITA for Uganda. And I'm also a plant pathologist by profession. Yeah, we have a major problem that we are dealing with, which is Banana Bunchy Top Virus. And then this one requires all of us to work together. So as IITA, we've been working on Banana Bunchy Top Virus for a very long time. And then we're part of the team that also realized or diagnosed the disease here in Uganda, in Kasese. And then through that, we are working with MAAIF, because MAAIF is where the NPPO, the National Plant Protection Organization, resides. So they are the ones who have the mandate to deal with the emerging pests and diseases. So we collaborate with them closely, and they are the ones who really coordinate everything for the country. And then with the ASARECA, because ASARECA is working for, it's an association that deals with bringing together different countries together, stakeholders together. Because this disease is not only in Uganda, but it's in different countries, member states for ASARECA. So they have the convening power for us to be able to work across the region in different countries. So we thought if we come together, the three of us, then we'll go a long way to manage the problem that we have at hand. We have been able to, to source for funding through funding that we've got from the Plant Health Initiative, from the East and the Southern Africa Regional Initiative, UKAMA, as well as from USAID and USDA. So we've been able to bring that, to get a little bit of seed money for us to be able to raise awareness about the disease and what causes it, where it comes from, what is the epidemiology, and what farmers need to do to prevent or to minimize the impact of this disease. So one of the things that we realize is that, what farmers don't know cannot help them. So building that capacity so they are in a position to correctly diagnose the disease and be in a position to pass this information to their peers in the community is super important for us to be able to manage the disease. So that's where now the collaboration with the MAAIF has come in. One, they are the ones who have the mandate, and working with them, we realize that not one institution can go it alone, but together we can go a long way. So we bring in the expertise, also the partners that we've been working with in different countries, as well as some of our funding partners together, and then with MAAIF to go and sensitize the community where they have the problem, and also others in the high-risk areas, so they are in a better position to deal with the emerging threats. One of the things we quickly realized under the UKAMA, the UU regional initiative, is that farmers learn more from listening to other farmers. As scientists or technical people, we have a way of disseminating information that might not be the best for the farmers. So we realize that if we are going to have an impact that we envision, we need to bring farmers from the high-risk areas where the disease is not there to the area where the disease is, who have been dealing with this for the past 3-4 years, so that they can, one, see the problem on the ground and they can appreciate the impact that it has, and two, they can learn from their peers on what they have been doing to manage the disease or to address the problem and the impact that this has had on their food security, banana production, and going forward, so that once they have all this information, when they go back, they become the champions in their own communities, disseminate the information so we can prevent the spread and the distribution of this disease. In terms of research, we have a long way to go. I think one of the things that has been coming up from the interaction is that we need to have a source of clean planting material, because we know that this disease, we don't have resistance yet. Our breeders are working very hard to come up with resistant varieties, but breeding is a long-term goal. It takes 15 to 20 years to come up with a variety. So in the meantime, we need to maintain banana productivity, and we can do that, culturally. So one of the things that we need to do is to make sure that farmers know exactly what needs to be done, and we need to establish within the communities or close to the communities that have been affected, some nurseries, banana nurseries, where they can get clean planting material that they can use for, to re-establish their bananas. The other thing that we need to do also is to do quite some bit of work in terms of the epidemiology, what is happening with the vectors, what can we do to manage the vectors so that we can minimize disease, disease spread and the impact. And of course, I think the socio-economic aspect of it is really important. We need to do some research to document the impact that this disease has on the farming communities in terms of income generation and food security and the livelihood of the farmers who have been affected in general. So those are some of the things that I think we need to be doing.